Welcome back to Living 808. Some exciting things are happening at Adventist Health Castle. Today we are learning about their advanced robotic surgery technology and how it's making hip, knee, and shoulder surgery faster and easier than ever before. Joining us now, Suzanne Asaro, Director of Joint and Spine Surgical Services, and registered nurse Patty Sutton. Hello, thank you both for joining us.
Good morning.
Good morning. Good afternoon, actually. Suzanne, let's start with you. Why did Castle go into robotics?
Now, Castle actually has been invested in robotic technology for knees since 2013 when the first generation of knee robotics came out. And we were very fortunate this past fall that we were able to invest in the latest technology. And we are now providing the knee robotics with our second generation, which then allows us to provide the most advanced technology. Castle's been doing joint care surgery since 1997, so we're well versed in hip and knee replacements, and we're providing excellent care, for over 20 years now. So, and over this time, we've been able to continue to advance our technology and expand our services. And Navio is just our latest in advanced technology.
Navio. Okay,
Yeah.
Patty, tell us, what is Navio?
Navio is a robotic technology that's very specific for knee surgery. It's the second generation and the newest technology out on the market. As with all robotic techniques, it provides a very precise, minimally invasive approach to doing the knee procedure that allows the patient to have a much shorter hospital stay, to have a much better outcome, and to also be able to recover totally from the surgery much faster. There's some other advantages Navio has.
Let's talk about that. What are some of the other benefits? I know a lot of people who actually need knee surgery or they've had knee surgery, but a lot of people, it's very scary, right? And they worry about the long-term effects and not being able to walk. But when you said minimally invasive, that made me happy because I know a lot of people like that. But what are some of the other benefits?
Well, right away at the beginning when you go for the surgery, preoperatively with the first generation technology, you need a CT scan to place the coordinates for the knee so they can make those precise cuts. With Navio, they're able to use a wanding device and they don't actually require that CT scan, so it saves time for the patient before the surgery. It also saves money because it's an additional test that's not needed diagnostically. And lastly, there's radiation associated with CTs, and the patient doesn't have to have that additional radiation with this test.
Suzanne, who is a candidate for this kind of surgery?
That's a great question. Of course, you want to fail conservative treatment, such as physical therapy or non-steroidal injections. But most patients that are a typical candidate, they'll be able to say, I have pain right here on this part of my knee. It's very specific. They'll be able to pinpoint that. Another typical patient would be pain or stiffness when you go to stand up after sitting for a prolonged period of time. So that pain and stiffness when you try to get going, those are our typical candidates. And then you can, of course, be evaluated further by our surgeons.
Okay, I'm sure a lot of people are watching this right now saying, I want to learn more. How do I learn more? Where should they go for more information?
We actually provide community seminars at least once a month at Castle. You can find out more by calling 263-5400 or visiting our website at castlemed.org, and you can find out more information about our seminars, or give us a call and we'd be happy to answer your questions.
Okay, thank you both for being here and giving us this information. I mean, this is a huge breakthrough, and it's not just for knee surgery, right? It's for other types of...
The Navio is focused on knee replacements and partial knee replacements as well.
Okay.
So you can do both.
Okay.
This system works better for more patients because we could only do partial knees before. Now we can do total knees, so a wider variety of patients get to do that. And in addition, it connects all four ligaments back to the knee, and it has a better cosmetic result. And the implant that we use is oxinium. With that implant, holds up longer, works better for the patient, and there's less trouble with metal allergy. So there's multiple reasons why this is really a benefit, and it affects many more patients.
Great. Suzanne, Patty, thank you so much for joining us. If you missed the information, don't worry, we're going to have it all on our website.